Okay, good.
All right.
Okay, perfect. So to describe the problem, we have for more than 1 year, Libya and Sierra Leone have been experiencing the largest and most complex outbreak of Ebola in history. According to CBS, it's a rare and deadly disease. The disease is caused by infection with one of the Ebola virus species. Ebola is spread by direct contact through broken skin, a mucous membrane, and an example, the eyes, nose, and mouth. Ebola causes headache, fatigue, muscle pain, vomiting, diarrhea, stomach pain, and unexplained bleeding or bruising. Sierra Leone is among one of the top locations that is experiencing the largest and most complex outbreak of Ebola in history. Currently, there is 13,945 suspected and confirmed cases in Sierra Leone. The use of mobile technology has the power to transform healthcare. It can help health workers in remote, isolated places get up-to-date training and provide quality healthcare. Research has indicated that Sierra Leone internet usage is the lowest in West Africa countries. They use the radio as the most popular and most trusted media source in Sierra Leone, with 72% of people in the country listening to radio and telephone and telegraph. Services are but improving. Internet usage is low, research reaching just 1.3% of the population in 2012, but improving with growth.
All right, here is the overview of the intervention. Better access to mobile technology would help improve access and quality of healthcare in Sierra Leone. Sierra Leone is one of the poorest countries in the entire world. It ranks 180th out of 187 countries according to the Human Development Index as of 2011. The average lifespan of someone who lives in Sierra Leone is only to age 46. There are many factors to why this is. Currently, Ebola has been sweeping their nation and taking thousands of lives. The most cumulative deaths from Ebola has been in Sierra Leone itself. The way we're going to help save lives in Sierra Leone is through mobile technology. In Sierra Leone, they have not had the means or the resources to be ahead of a disease like Ebola that can simply spread through the shaking of hands. With mobile technology, we can improve access and quality of the healthcare in Sierra Leone. It will provide instantaneous training for healthcare professionals, which will reflect the care that people are receiving. This, in turn, will save many lives and improve the quality of life for the people in Sierra Leone. We will find a way to get phones donated so we can recycle them to gain money for new phones. Then there will be an application that healthcare workers will be provided with to better equip themselves. We may also team up with the Red Cross, who has partnered with the Vice President of Sierra Leone to give us the full backing of sending out massive text messages to thousands of people in Sierra Leone. We will provide local healthcare workers in Sierra Leone with the mobile device that has the healthcare app on it.
Mobile innovation can offer opportunities to increase both the capacity of clinicians and the timeliness of delivery of critical health services. They have brought needed medical expertise to frontline healthcare workers, systemized the compilation of patient information, tracked the spread of epidemics, and boosted disease training, diagnosis, and treatment. The bottom line is that mobile solutions represent a valuable way to improve patient treatment and public health reporting in the developing world. Technological innovation has the potential to help healthcare workers manage Ebola in Sierra Leone. Training healthcare providers was a priority at the beginning of the Ebola outbreak. A survey found that 85% of healthcare workers in the country believed you could avoid Ebola by abstaining from handshakes or touching. Correcting these beliefs about the disease is a critical part of the response effort, especially for healthcare workers. One of the virtues of mobile technology is its speed and flexibility. Mobile allows officials to quickly disseminate the latest information to frontline health than paperwork records. Deborah Theobald, co-founder of Vecna Technologies, creator of the Health platform in Nigeria, has pointed out that if a patient is isolated, so is their paperwork. Electronic records are easy to share and also lower the risk of infection for healthcare workers.
We will implement our intervention in Sierra Leone by creating a website to educate the public about our cause. We will also put ourselves on social media like Facebook and Twitter. We will advertise online and find people and organizations who are interested in donating old cell phones to help the people of Sierra Leone. We would allow people to organize a phone drive in their communities and in their workspaces. There would be an option to donate money for phones and tablets and providing adequate internet on the site as well. Then, when people donate a phone, we would have it recycled by a company that would best meet our needs and take the profit from that and purchase new phones and tablets. We would choose phones and tablets that are rugged, simple, cheap, and have a longer battery life. When we receive the phones and tablets, we would load them with the mobile medic app to help healthcare workers who would receive the phones from us. We would send trained healthcare workers willing to donate their time and efforts to Sierra Leone. We'd also send over trained people to help make sure there was adequate access to internet. We would have the trained healthcare workers meet with those local healthcare workers in Sierra Leone to teach them about mobile technology and how to use the mobile medic app to help them understand and learn more about Ebola and other diseases. Then they could learn the best ways to treat the diseases they see and even be able to communicate with other local cities to help stop the spread of the disease. We would hold continuing education classes to make sure the workers are properly using their devices to make sure everything is working well.